If you are over 70 or you love someone who is, this message could quietly protect your health more than any pill or test ever could. Because here's a truth most seniors are never told. More testing does not always mean better care. In fact, some routine health checkups that sound responsible and safe can actually create stress, unnecessary treatments, dangerous side effects, and even shorten quality of life. Doctors rarely say this out loud, not because they want to harm you, but because medicine often follows habits instead of common sense. After 70, the body changes, priorities change, and what helped at 50 may hurt at 75. Today, let's talk honestly about 5 health checkups seniors over 70 should seriously reconsider or avoid unless there is a strong medical reason. This is not about ignoring your health, it's about protecting it wisely. First, let's talk about aggressive cancer screenings that continue automatically year after year. Tests like routine PSA screenings for prostate cancer, frequent mammograms, and certain cancer blood tests are often pushed even when there are no symptoms. What most people don't realize is that many cancers in older adults grow extremely slowly. Some never cause harm at all. But once a test finds something abnormal, a chain reaction begins. More scans, biopsies, surgeries, radiation, and medications follow. These treatments can cause infections, bleeding, weakness, urinary problems, sexual dysfunction, and long recovery times. For a 75 or 80-year-old, these side effects can permanently reduce independence. Many seniors end up being treated for cancers that would never have affected their lifespan. That's why many medical organizations now say routine cancer screening after a certain age should depend on overall health, life expectancy, and personal choice, not automatic scheduling. Testing without symptoms can turn a healthy senior into a patient overnight. Next, let's talk about full-body CT scans or whole-body screening scans that are marketed as peace-of-mind tests. These scans expose the body to high levels of radiation. That alone is a concern, especially when repeated. But the bigger problem is what they find: tiny spots, harmless cysts, old scars, and age-related changes that mean nothing. But once found, they can't be unseen. Doctors feel pressured to investigate them. This leads to more scans, invasive biopsies, and anxiety that lasts for months or years. Seniors often end up worrying about things that were never dangerous. Instead of peace of mind, these scans create fear, medical debt, and unnecessary procedures. For seniors over 70, these scans rarely improve outcomes unless there is a clear symptom or medical reason. Another checkup seniors should be cautious about is frequent stress testing or heart imaging when there are no symptoms. Many older adults are sent for treadmill stress tests, nuclear scans, or heart catheterizations simply because of age. But heart tests are not risk-free. Some involve contrast dyes that strain the kidneys. Others can lead to procedures like stents or surgeries that may not improve lifespan or quality of life in older adults without symptoms. Many seniors live comfortably with mild heart disease that never causes problems. Testing can turn a stable situation into aggressive treatment, medications with side effects, and hospital stays. Modern guidelines now suggest that if a senior has no chest pain, no shortness of breath, and no major functional decline, aggressive heart testing should be carefully weighed, not automatic. Let's also talk about routine colonoscopies after 70 or 75. This is one of the most misunderstood tests in older adults. Colonoscopies are not harmless. The preparation alone can cause dehydration, electrolyte imbalances, dizziness, and falls. The procedure itself carries risks of bleeding, bowel perforation, and complications from sedation. As people age, these risks increase significantly. Meanwhile, colon cancer often takes many years to develop. For many seniors, the chance that a colonoscopy will prevent a life-threatening cancer is very small, while the risk of harm from the procedure is real. Many medical groups now recommend stopping routine colon screenings after 75 unless the person is very healthy and has a strong reason. Stool tests or symptom-based evaluation are often safer options. Now, let's talk about excessive blood tests and lab panels done just to check everything. This may sound harmless, but it often creates confusion and over-treatment. As the body ages, lab values naturally shift. Slightly abnormal numbers are common and often meaningless, but once a number is flagged, medications are prescribed to fix it. One drug leads to side effects, which leads to another drug, and soon a senior is taking a handful of medications that were never truly needed. This is called the prescribing cascade, and it is one of the biggest dangers in senior health. Too many medications increase the risk of falls, memory problems, kidney damage, and hospitalizations. Testing should be targeted, not routine and excessive. Another commonly overlooked issue is bone density testing, done too frequently or without context. Bone scans can be helpful, but repeating them often or using them to push aggressive medications in very elderly adults can backfire. Some bone drugs stay in the body for years and increase the risk of jaw problems and unusual fractures. For many seniors, simple measures like balance exercises, vitamin D, strength training, and fall prevention matter more than chasing perfect bone numbers. A scan should guide thoughtful care, not automatic medication. There's also the issue of memory testing done too early or too aggressively. Mild forgetfulness is normal with aging, but once a label is applied, such as mild cognitive impairment, it can change how a senior is treated, how family members view them, and how confident they feel about themselves. Some medications prescribed for memory have limited benefit and significant side effects like nausea, dizziness, and sleep problems. Before rushing into testing and labeling, it's important to consider sleep quality, stress, hearing loss, depression, and medications, all of which can affect memory and are often reversible. Another checkup seniors should rethink is frequent imaging for back pain or joint pain without warning signs. MRIs and X-rays almost always show abnormalities in older adults. Disc bulges, arthritis, and wear and tear are normal, but once seen, they often lead to injections, surgeries, or strong pain medications. Many seniors are told they need surgery based on scans, even when symptoms could be managed with physical therapy, movement, and lifestyle adjustments. Imaging should be reserved for serious symptoms like weakness, numbness, or loss of bladder control. What's important to understand is that avoiding certain checkups does not mean neglecting health. It means choosing smarter care. After 70, the goal shifts from finding every possible disease to preserving independence, comfort, mobility, and joy. Quality of life matters more than chasing numbers. Energy matters more than perfect labs. Peace of mind matters more than unnecessary diagnoses. A good doctor will ask different questions after 70. Can you walk comfortably? Are you sleeping well? Do you enjoy your days? Are you eating well? Do you feel steady on your feet? These questions predict health better than many tests. Unfortunately, the healthcare system often focuses on tests because they are easy, familiar, and billable. If you're over 70, the most powerful health checkup you can do is a conversation. Ask your doctor, how will this test help me live better or longer? Ask, what happens if we do nothing? Ask, what are the risks at my age? These questions shift care from automatic to intentional. It's also important for seniors to understand that guidelines change, but habits don't. Many clinics continue to schedule tests out of routine, not because they are necessary. You have the right to say no. You have the right to pause. You have the choice to choose comfort and clarity over fear. True senior health is not about doing everything. It's about doing what truly matters. Staying active, staying connected, eating nourishing foods, moving daily, managing stress, and avoiding unnecessary medical harm. The healthiest seniors are not the ones with the most tests. They are the ones with the least disruption to their lives. If this message made you rethink even one test, it has done its job. Share it with someone over 70 who trusts doctors but deserves to trust their own judgment too. Sometimes the best medicine is knowing when to step back. Your health is not a checklist. It's your life.